What's up, Millennium listeners? Welcome back to another episode of the Millennium Live podcast. It's great to be here in 2024, and we have another great episode as we're making our way to number 250. After starting the podcast back in December of 2018, we've made it this far, and our guests and our partners just seem to keep getting better. Because I have another partner with us today who's transforming care delivery by meeting patients where they are and making healthcare more accessible, actionable, and always on. We have Memora Health here, and to talk all about Memora and some of the great work in healthcare today and some great predictions probably for this year is Gordon Rosen. He's the managing director of revenue. I want to welcome him to the podcast right now. Gordon, welcome to Millennium Live. It's great to be talking with you in 2024.
Yeah, Connor, it's a pleasure. Thanks so much for having me. And really excited to be here and looking forward to the dialogue.
Sweet. So kind of to jump right in, I'd like to get to know more about you and your role at Memora Health and maybe what the mission is. So just to kick things off, maybe a little introduction for our audience about Memora Health and a little bit about the mission there and your role as managing director of revenue.
Yeah, absolutely. Yeah, so Memora Health was founded in 2017 with the goal to streamline a lot of the work that's really difficult for clinicians to do today. And we've been leveraging AI since 2017 in order to make those clinical workflows much more automated and digitized on behalf of the care teams in order to engage patients more effectively. As we think about kind of the dynamics in play in the industry right now, you have patients on one side who are seeking a much better experience, right? With COVID and kind of the rise in consumerism, their expectations are higher than ever. They want to be at home. They really don't want to come see the doctor, see their nurse, et cetera. And so ultimately what we've had to think about is how do we fundamentally shift care delivery to the home? And simultaneously, we have to keep an eye on the care team as well, right? Making sure that when we shift care home and ask them to do more, that we're actually leveraging technology to take work off their plate. So yeah, been a great ride. I've been here for about 2 years as managing director. Was brought in to really lead our partnerships team with health systems across the country. Lots of conversations on a daily and weekly basis about the challenges everyone's having and how we can ultimately leverage our solution through partnership to help them reach a better future state. So yeah, been a fantastic ride so far.
Well, that's awesome. And it's great to have you on the podcast. And you mentioned big buzzword. It's something that I've talked on the podcast many times to end 2023. But, AI is obviously a hot topic across the board, no matter what industry you're in. And I'm curious, you got a good point there that Memora has been leveraging AI in clinical communications for going on 7 years since 2017. So can you talk to us a little bit about how Memora uses and implements AI in their solutions? Are you using generative AI or, what has your approach been?
We are not using generative today. That's something that's under consideration on our product roadmap. But historically, our approach to AI has been very much using what we call retrieval-based or deterministic models. And that's by design. In doing so, it allows us to be intentionally cautious. We can really focus on safety. And it allows us to control clinically validated pathways that we've built. So while there is a lot of excitement, I know generative is obviously being used. You look at Epic, you look at the work that various CRMs are starting to put into generative. I think there's a lot of opportunity there, but one of the things, especially in healthcare, given that we have patients' lives that are at stake, right? Safety is just such a critical piece. And so our take here at Memora is there's always going to have to be some kind of clinician intervention, right? Even if you use AI to automate a lot of the work, you're still going to have that clinician oversight. So by using retrieval-based models, we've actually been able to automate a lot of the workflow because we know the outcomes of the AI that we're ultimately going to be able to deliver to the patient because we've tested that, we've refined it, we've validated it with our customers, and so they're also comfortable with it as well. So in doing so, we can really have a calculated approach to what goes out to the patient, the type of care guidance that they're getting, and the care team can feel comfortable as well with that true kind of autopilot component that allows the work to continue to be taken off of their plate.
One of the things that I'm fascinated by when I talk to solution providers across multiple industries about selling their software, it's that it's a tough business to be in, and being in a revenue role yourself. I imagine selling to enterprise SaaS to health systems and health plans is not an easy task, and you need to find ways to stand out. So how does your team navigate such complex organizations, navigate the health system? How do you manage all this, Gordon?
Yeah, it's certainly not easy, right? There's been tremendous pressure from pretty much every direction on health systems over the last couple of years, right? Obviously, it was COVID initially, and them really trying to figure out how to ultimately take care of patients, keep their care team safe, et cetera. They made a lot of digital investments at that time, right? Kind of out of dire need. Now we've seen kind of them come out of the pandemic, right? And there's a whole nother slew of problems, right? It's declining reimbursements, it's sicker patients, right? It's staff burnout. And so there are a lot of things, right, on their plate that are creating a tremendous amount of challenge for them. So when we think about how do we partner, right, there's a couple of things to keep in mind. Gone are the days of, someone just buying a solution on a whim, right, without a strong ROI, without a strong validation that they don't have that solution in place already. Gone are the days of someone, circumventing IT, right? And so really what it comes down to is understanding the process that everyone's going through to evaluate technology, and also the things that are top of mind, right? So when we think about partnership, there's a few key things that we keep in mind every time. The first is the financial side, right? Knowing that margins are raised within one or two hospitals right now is losing money. How do we come to the table and look at performance-based type of contracts where we truly have skin in the game and we require less money up front for them ultimately to leverage Memora and to create value for their organization? So I'd say that's a key one. The second one is from an IT standpoint, just knowing that there was an overinvestment in digital solutions and somewhat of a fragmented and disorganized way during COVID. And now there's this whole rationalization of existing tech before they bring in new. So thinking about ways that we can truly partner, help them understand existing technologies, where Memora fits in, if there's solutions that we can replace where there might be redundancy, how we plug into core platforms like their CRM and their EMR. So those things are critical, and oftentimes we'll bear some of the costs of that IT integration and migration to get Memora into the organization as well, recognizing that again resources are very much finite. So those are a couple of the kind of the key ways. The other one, third way I'd say that we think about is knowing that clinicians are burned out, and Memora is a solution that automates a lot of the clinical workflows. We do require a small amount of clinician input during the implementation process. So what we've really kept in mind is how do we implement while offering kind of over investing in clinical resources on our side to make sure that we're mapping Memora to existing workflows. We're helping with the change management piece. We're bringing that clinical expertise to the table so that they can continue to take care of their patients and do what they do best and what they should be doing, right? And Memora bears a lot of that, the lift as well. So again, just being really thoughtful about the things that are top of mind for health systems and coming to the table as true partners in order to create that true long-term partnership.
Gordon, you mentioned a couple of really good points, and one of the biggest barriers to digital transformation at enterprise organizations is often cultural change and the speed at which organizations can upgrade and adopt new technology. I think historically, you can argue that healthcare has usually been slow to adopt new tech. So does that kind of speak to what you're hearing from health systems and kind of being at their level? And if so, how are you working to get ahead of these challenges?
Yeah, absolutely. So I have the conversation all the time, whether it's with friends and family or just with other colleagues in the industry. And it's mind blowing how slow health systems are to adopt technology, right? And a lot of it's because they somewhat have to be, right? There's a lot of sensitive data at hand, right? We're talking about patients and their patient health records, right? So security compliance is always going to be at the forefront. I think when it comes to adoption, though, there are ways that some health systems do this better than others, right? I've seen some organizations where they truly have an eye on innovation, right? And they have a group of leaders, both on the business side, operational side, and clinical side, that allow them to vet these technologies. And they're not necessarily like looking for the technology first. They're looking for the problems that they're trying to solve, right? Clinician burnout, they're looking at new ways to generate revenue, you name it, right? So looking at the problem, they're organizing a user group, right, around that problem, and they're going to look at solutions in the market and bringing those in to solve those problems, right? So that seems to be kind of the most effective way. You have all the decision makers at the table, you have a true problem to solve, and you find the right partner. And then from the partnership standpoint, it comes back to things like, what is the return on investment? What value are we expecting to create? And then once we do strike a partnership, how do we know that it's successful, right? What are those key success metrics that we're driving towards as part of the relationship that we've entered into? So, yes, without a doubt, health systems are slow to adopt technology, I think oftentimes by design, but there are health systems that are doing this right and are moving faster than others by truly creating that kind of core group of folks that can move technology in, try it, fail fast, and then scale what works.
So, leading a sales team through not only the rapid growth that you've experienced, especially at your time at Memora, but also the rapid changes in the market over the past 18 months must have had its challenges. So, Gordon, I'm actually curious. Can you share, anything that you might have learned along the way, and some key takeaways over the last year that you've seen in your role?
Yeah, absolutely. I think one of the key takeaways is right in a challenging sales environment, you have to remain optimistic, right? Like when you're doing the blocking and tackling of what ultimately will successfully lead to a partnership, right? Like you just got to keep doing those things. At the end of the day, the results will come, right? So I think that's key, right? Stay true to your beliefs, stay true to the process that you developed. That ultimately will get things done in the long run. I'd say the other thing that's true also is when times are tough, right? Like things can be stressful. People can obviously become, stressed out, negative. Like you can really create a somewhat of a toxic culture by a nature of like things slowing down on the sales side. I think one thing that's critical is to continue to bring the positive energy, right? And talk about what's winning and celebrate the small wins, right? Because when you're selling a health system and it's a 12-month sales cycle, right? There's going to be a lot of wins along the way that are extremely exciting. And so I think really like making sure you celebrate those, continue to build up the positivity, and continue to lean into support, right? And have the whole organization support as well, right? It goes beyond the sales org or the commercial org. Everyone's in this together as, we all ultimately are working towards these partnerships and having a lasting impact on healthcare.
Well, that's awesome, Gordon. And I know I don't want to keep you. I know you're busy making sure your revenue cycle is being taken care of. But I like to end the podcast usually around talking about the future and some advice. And now that we're in the new year, we're not really talking too much about predictions for this year. But since we're kicking off Millennium Live in 2024, this is a moment of reflection to kind of prepare yourself for the rest of the year. And as you look ahead this year, what's your outlook on 2024 and how it will compare to the last couple of years?
I'm optimistic, I guess, in a leadership role on the sales side. You have to be somewhat, but I truly believe that I think we're coming out of a no doubt a tough couple of years, right? Came out of the pandemic. Hospitals were in dire financial shape. We're going to see a little bit of a rebound. Saw a little bit of rebound in 2023. And so thinking about 2024, I think, things will continue to be challenging financially and with workforce, but I think like there's going to be a little bit of a leveling off across the industry that's going to allow organizations to start to think a little bit more strategically versus like truly in crisis mode. So yeah, I'm excited about the year. I think that there's going to be, one thing that's true is health systems are going to continue to have to double down, triple down on technology investments, right? Like there's no way we can hire our way out of the financial challenges and out of the revenue challenges that we're seeing. And so I'm super optimistic that technology companies that can truly impact total cost of care, can impact top line revenue, can impact patient satisfaction experience, right? Those types of organizations are they're going to win at the end of the day, right? Just a matter of staying true again to the process, building the relationships and making sure that you continue to create results for your customers, that you share those across the industry. So I think 2024 is going to be a good year, and I'm excited about it.
Yeah, I hope it is. And hopefully we can chat in December of this year to kind of get an update and your thoughts and, where Memora is. And I know it's no doubt that navigating healthcare is challenging, but I'm glad a partner like Memora Health is simplifying that journey for both patients and clinicians. Gordon Rosen, Managing Director of Revenue at Memora Health. Thank you so much for joining Millennium Live. It's great to have you, especially to kick off this episode in 2024. And we'll see you soon.
Sounds great, Connor. It was a pleasure. Thanks so much for having me.